Now coming to the posterior leg. So the most superficial muscle is your trapezius. So if I am hiding the trapezius, so then I am hiding the trapezius on both the sides. So this is your splenius capitis. So the splenius capitis will be on the little bit of the lateral side, and the most important muscles when you will be coming from apart is your the semispinalis capitis. The very bulky muscles. And if you are going laterally at the level of the C2, C1, then gradually the splenius capitis will come. And if you are using the splenius capitis and semispinalis capitis both, then the very important structures will be coming out. I'm hiding both semispinalis capitis and the splenius capitis. Again, repeating all these muscles, because if you wish to do the greater occipital nerve block, third occipital nerve block, which are very common pain procedures, so there you need to know all this anatomy layer by layer muscles. So I have to go in very details. I'll be discussing that again. I'll be showing you here, and when I'll be demonstrating on the volunteer, that time also I'll be showing you the SonoAnatomy. But here, this part, please listen attentively about all these layer by layer structures. So what was there? I have removed the splenius capitis on the lateral side, and I have removed the semispinalis capitis. As I told you, semispinalis capitis is a very big bulky muscle. It has basically the two layers, one on the medial side and another the medial fascicles and the lateral fascicles. And when we are moving that, a few important muscles are coming. This is your the rectus capitis posterior minor. So this is a small muscle from the occiput. It is coming inserted into the arch of the C1. And then just lateral to that, little bit longer, little bit bigger, is your rectus capitis posterior major. So rectus capitis posterior minor, rectus capitis posterior major. And rectus capitis posterior major is getting inserted over the C2 spinous process. And the C2 spinous process, another very important muscle is originating. It is the rectus capitis, your inferior. So, obliquus capitis inferior. So, between the obliquus capitis inferior and this semispinalis capitis, we will be searching for the greater occipital. So, this obliquus capitis inferior, and above that, obliquus capitis superior. This is your obliquus capitis superior, not this one, this one. Obliquus capitis superior. So this muscle, they are getting attached to the C1. This obliquus capitis inferior is from the C2 spinous process and going up to the C1 spinous process. And here, another very important thing when will be coming from above is the first bifid spinous process is your C2. So let me repeat here again. On the midline, the first very small muscles will be coming, that is your trapezius. If you are removing the trapezius, then there will be very important bulky muscles is your this one. This is your semispinalis capitis. And if you are going laterally, this is your splenius capitis. So if we are removing these two muscles, they will be getting these small muscles. This is your rectus capitis posterior minor. This is your rectus capitis posterior major. This is your obliquus inferior, and this is your obliquus superior. So these are the muscles that you will be able to see. Very important is to identify these muscles. These muscles is most important. Over the lamina of the C2, these muscles is your obliquus capitis inferior. Obliquus capitis inferior. So between the obliquus capitis inferior and the semispinalis capitis, we'll be searching for the greater occipital nerve and the third occipital. If you are going a little bit laterally, then what we'll see, we'll be getting the sternocleidomastoid. Sternocleidomastoid again very important, because here we'll be getting, if I'm adding the nerves, you will see here the superficial cervical plexus. From the superficial cervical plexus, the nerves will be coming. One of them is the lesser occipital nerve, which will be going like this. So look at the neck position. So neck is flexed maximally as much as possible, and we'll start scanning from. So you remember the muscles. When I'll be holding the muscles posteriorly, I'll be first getting the small strip of the trapezius. After the trapezius, what I'll be seeing is the midline, the semispinalis capitis, and if you are going lateral a little bit, you'll be getting the splenius capitis. And below the semispinalis capitis, we are having the rectus capitis posterior minor. Above, little bit laterally is your rectus capitis posterior major. And if you are still coming down, then you will be getting the obliquus inferior, obliquus capitis inferior. And I told you this inferior oblique is also called the inferior oblique muscle. So this inferior oblique muscle is most important. It lies over the lamina of the C2 and it goes to the obliquely towards the transverse process of the C1, and in between below the semispinalis capitis and the obliquus inferior, we'll be searching for the greater occipital. So, and lesser occipital now we will be finding on the medial border of the sternocleidomastoid. That is a superficial subrectal plexus nerve. And third occipital will be also seeing medial to the greater occipital. So, again, let me increase the depth a little bit. So here, the midline, I'll be starting from the occiput. So ideally, to have the good things, you should be saving the hairs, then you can see better. So starting from the occiput, and then the change. So here, the most superficial muscle what we can see is your trapezius. And now, when it will be coming down, I'll be getting the arch, C1 arch. This is the midline. And two muscles here appearing is your just small stipes is your rectus capitis posterior. Now, this is your semispinalis on either side. And below that, this is your rectus capitis posterior minor. So this very small thin muscle is your trapezius. After that, rectus capitis posterior. Sorry, semispinalis. After that, rectus capitis posterior minor. And if I am coming still below, rectus capitis posterior minor will be ending at the level of the C1. So this is your C1. This is your arch of the C1. Why it is arch of the C1? Because we can't see anything beyond that. So there the rectus capitis posterior minor is ending. If I'm going above, you can see this is your rectus capitis posterior minor. If I'm going straight in the above, if I'm coming down, then we can't see anything of the rectus capitis posterior inferior because that has inserted. And now if I'm coming still a little bit down, then I'll be getting the rectus capitis posterior minor that will be inserted. So now this is what is coming. This is your C2 spinous process. This is your C2 spinous process. And if I am coming laterally, little bit. So this is your rectus capitis posterior, your major. This is the rectus capitis posterior major. This is between the C1 and C2. And if I am coming here, the rectus capitis posterior major is basically inserted over the tip of the spinous process. And on the lateral side, what I can see is this is the most important muscle as I was telling you. This is your obliquus inferior, and this is the semispinalis capitis. If I'm going a little bit more laterally, let me put some more gel, then I'll be getting the splenius capitis, and also I'll be getting the sternocleidomastoid inserting there. So I was here. So I was here, coming down gradually. So this was your C2. Then looking at the slope, you can understand this is C2. So this is your C2 lamina. And this is your semispinalis, and this is your oblique. And if I am going laterally, so this is coming your splenius capitis. Splenius capitis will be laterally and above it will be covering partially the semispinalis capitis. And if I am still going above, below this muscle is your longissimus muscle. And this muscle is your sternocleidomastoid muscle. So, sternocleidomastoid muscle, just medial to that, we have to search for the lesser occipital nerve. I can see the lesser occipital nerve there. This is your lesser occipital nerve. Let me reduce the depth, then you'll be able to appreciate it better. Can everybody appreciate the lesser occipital nerve? This is the lesser occipital nerve, just below the white thing. So this was your sternocleidomastoid muscle. This is your the splenius capitis muscle. This is your semispinalis capitis. This is your longissimus. This is your inferior oblique, and this is your the lesser occipital. Okay. So now let me search for the greater occipital. So again, let me go more towards the midline. So this is your C2, and this is your obliquus. So now obliquus is little bit obliquely oriented. What I'll do, I'll be rotating my lateral aspect of this towards the C1. And now I'll be searching. Can you see this greater occipital nerve very nicely? So this is your greater occipital nerve. This is your greater occipital nerve. Look at that. If I'm tilting the probe, that is your greater occipital. And more medially, this is your third occipital. See, this is your greater occipital. This is your greater occipital. And if I am making it opposite this way, this will be the cross section of the. So here I'll be seeing two muscles. This is the cross section of the the obliquus inferior, and this is the cross section of the your rectus capitis posterior. So there are two muscles, rectus capitis posterior, your major. And now, hey, and now you can see the long axis of the greater occipital. So greater occipital now comes like this obliquely. So from the it is goes superiorly. So now you can see the very nice your long axis of the nerve, this black one, it is this SLC. And if I am coming here, then I can see now it is cross section. Now it is cross section. If I am holding it obliquely. So you see, this is your the greater occipital. So these two nerves are very, very important. And for these two identification of the two nerve, what is the clue? The clue is you have to identify the C2 lamina. Above the C2 lamina, you will be getting the inferior oblique muscle. Above that, there is your the semispinalis capitis muscle. And in between the obliquus inferior and the semispinalis, you have to search for the greater occipital. Is it clear to everybody? Greater and the lesser occipital nerve. Please say something.
Yes, sir.
Okay, you can see recording also. But if you wish to show me again, I can show you.
Sir, please show again.
Which one? Both?
Yes, sir.
Okay. Okay.
It's very confusing, sir.
So remember the layer by layer muscles first. That is important.
Yes, sir. Yes, sir.
So just let me recapitulate. Or shall I show the 3D anatomy again?
No, sir. There's no. No, sir.
3D anatomy is not needed. Okay, fine. So just remember, if your above trapezius is very thin layer of the trapezius muscle. After the trapezius muscle, if you are removing, it will be the semispinalis capitis towards the midline, and if you are going laterally, above the semispinalis capitis, it will become the splenius capitis. That will be the most likely. Below the semispinalis splenius capitis, another small muscle is the longissimus. Now coming to the towards the midline, if you are removing the semispinalis capitis, below that, the two muscles will be coming longitudinally. The most medial and short is your rectus capitis posterior minor. That is from occiput to the C1. And just lateral to that, little bit obliquely, is your rectus capitis posterior major, which comes up to the tip of the C2 spinous fossa. So you need to know this anatomy, then only you'll be getting understanding very nicely. And below that, there is one muscle which is over the C2 lamina, is your obliquus inferior, obliquus capitis inferior, and there is another obliquus capitis superior. Obliquus capitis superior is not that important. Obliquus capitis inferior is very important. So I am showing you again. So I am starting. Okay. So thin layer of trapezius. And then when I'm coming here, so what I can see here, this is your sphenius capitis. This is your this is your trapezius, sphenius capitis, and this is your rectus capitis posterior minor, and this is your rectus capitis posterior major. If I'm coming now, rectus capitis posterior minor will be vanishing. So here the rectus capitis posterior minor is vanishing. This is at the level of the C1. And then if I'm going down, then the rectus capitis, this is your C2 spinous process. This is your C2 spinous process. And here the rectus capitis posterior major also will be going. This was your rectus capitis posterior major here. Rectus capitis posterior minor and major. Minor is towards the midline, major is towards this side. This one is major. So that is also getting vanished, getting attached to the C2 spinous process. So I am holding the probe exactly in the middle. And now if I am going here, this big muscle was your semispinalis. Semispinalis identification is very easy. Going laterally, so this was your sphenius capitis. This was your sphenius capitis, and this strap muscle-like thing is your sternocleidomastoid, and this is your lesser occipital. Can you appreciate the lesser occipital nerve there? This is
Yes,
your
sir. Yes, sir.
lesser occipital nerve. So where is lesser occipital nerve? Remember these three muscles. One is your, this is your what muscle? Semispinalis capitis.
Sphenius.
This is what muscle?
Sphenius capitis.
Very good. This is what muscle? Longus.
Longus.
This is what muscle?
Sternocleidomastoid.
Very good. And this is your just medial border of the that is your lesser occipital. Okay, fine.
Yes, sir. Yes, sir. Yes, sir.
Now I am going down and I am coming over the C2 lamina. Here I was in between the C1 and C2. So here I am C2 lamina. Here you see this is rectus capitis posterior minor, major was seen. Rectus capitis posterior major is, this was mentioned as posterior major, and that is getting vanished, is getting attached over the C2 spinous process. See here, you can see only the obliquus inferior. If I am going, this is the lamina. And here what you can see, muscles you can see from the above down, is a very thin layer of the trapezius. After that, this is your semispinalis, obliquus inferior.
Inferior obliquus.
This is exactly what the C2. If I look at my probe, I'm little bit above. You see now what is this muscle coming? This is now what?
Major.
Rectus capitis posterior major. Very good.
Major.
And if I'm going still above, this is major. And now here it will be coming. This is your rectus capitis posterior
Minor.
Yeah. So our interest is here. So where we are having the C2. So at this level, rectus capitis posterior major was seen here, minor obliquus capitis here. So now what I'm doing at this position, you can see this is the fibers in the long axis. But this fiber of the long axis will be better seen if I'm tilting the lateral side of the probe towards the ear. See, I'm tilting it. Now these fibers are now better seen. Can you appreciate that? I've tilted it.
Yes, sir.
So now it is on the long axis of this muscle. And now you can see the cross section of this nerve. I'm tilting it, I'm moving it, and you appreciate the nerve very nicely. So there are two nerves.
Yes, sir.
Here is another, that is your third occipital, and this nerve is your,
Greater occipital.
No, greater occipital cross section. But if I'm tilting the probe exactly opposite, I'm just look at this nerve, keep the eye on the nerve, I'm keeping it to the center. I'm reducing the depth a little bit. So now look at here in this and see what is happening. Can you appreciate the long axis of the nerve now? Yes?
Yes, sir. Yes, sir. Yes,
Okay.
sir.
So now see, look at my probe, how I am holding the probe here. So I am holding the probe. Now I can see the cross section of the two muscles. This was your cross section of the what muscle? Rectus capitis posterior major, and this is the cross section of the obliquus. Okay, because these two muscles are like this. So obliquus. So this muscle is the obliquus, and this muscle is the rectus capitis posterior major. So if I'm holding the probe like this, I'm seeing the cross section of these two muscles. And I can see the long axis because nerve is wrapping around this oblique interior like this. If I'm holding the probe like this, I'm just seeing the long axis. And if I'm holding the probe along the muscle, I'm seeing it in the short axis.
Yes, sir. Much clear.
Yeah,
Yes, sir. Yes, sir. Thank you so much.
Okay.